Have you ever wondered why the pain in stable angina occurs during physical exertion? Watch this video and you will know the answer. Like all other tissues in the body, the heart muscle needs oxygen-rich blood to function. The coronary arteries wrap around the outside of the heart and supply blood to the heart muscle. The heart muscle requires a constant supply of oxygen to function. Normally, the oxygen demand of the heart increases with physical activity because the heart has to pump more blood to meet the increased metabolic needs of the body during exercise. In this situation, the coronary artery vasodilates to provide more blood to the heart to meet the myocardial oxygen demand. But what happens with coronary atherosclerosis? Atherosclerosis can affect most of the arteries in the body, including the coronary arteries. In atherosclerosis, buildup of fats, cholesterol, and other substance in and on the artery walls forms a plaque. Lipid deposition in coronary arteries can cause narrowing and hardening of the arteries. Depending on the size of the plaque, this will reduce or stop blood flow to the heart. But the question is, why does the pain in stable angina occur during physical exertion? At rest or mild activity at times of low oxygen, the heart's oxygen demand is relatively low. So, despite the narrowing and the hardening of the coronary arteries, they might still be able to supply enough oxygen to meet the heart's lower demand at rest. Because the oxygen supply is sufficient to meet the low demand, there is a balance between oxygen supply and oxygen demand. There is typically no chest pain at rest. However, during exercise, the heart has to work harder, which significantly increases its oxygen demand. Because of atherosclerosis and the hardening of the arteries, the coronary artery may not be able to increase the blood flow sufficiently to meet the increased oxygen demand during exercise. This will lead to a mismatch between the high oxygen demand and the inadequate oxygen supply, leading to ischemia, reduced blood flow to the heart muscle, causing chest pain or discomfort known as angina. And that's why patients with stable angina experience chest pain upon physical exertion. Finally, this slide summarizes the relationship between cardiac oxygen supply and cardiac oxygen demand at rest and during exercise in a patient with stable angina, and how it relates to chest pain. Thanks for watching.